Assalamu alaikum everyone, myself Hadisa. Today I'm going to share the syndrome that's called as Emberger Syndrome, or we can say Emberger disorder. It's a very rare genetic disorder in which GATA gene is involved, which causes the two characteristics, that is lymphedema and myelodysplasia. Now what is this lymphedema? Lymphedema means there is a swelling because of the lymph fluid buildup, abnormal lymph fluid buildup in the lower limbs mostly. That's called a lymphedema. And there is a myelodysplasia. It means there is an abnormal bone marrow function. Bone marrow, you all know. Now, what are the signs and symptoms in this Emberger syndrome? There is firstly the hematological abnormality. That means the bone marrow does not make or does not produce the healthy blood cells like RBCs, WBCs, platelets that are not normally healthy blood cells. There is an increased risk of developing acute myeloid leukemia. That's a type of blood cancer. Patient is having a lymphedema, as already told you about this. And the patient is having a congenital deafness. Congenital means from the birth. Patient is having a hearing problem. He is not able to hear the things properly. We can diagnose this problem by different techniques. Firstly, we can do the clinical examination or evaluation, by which we can check these signs and symptoms of the patient. If there is any kind of swelling in the limbs, or the patient is having a deafness, that is the clinical evaluation by which we can identify the patient is having a Emberger syndrome. But this is not a confirmation test. Then we move towards the hematological investigation, by which we can check the bone marrow test of the patient to check the abnormalities of the bone marrow. And lastly, we do the genetic test. This is the confirmation test by which we can detect that patient is having a Emberger syndrome. This syndrome has only one curative treatment, that is HSCT, that is called as a hematopoietic stem cell transplantation. This is the only curative treatment for this syndrome. Other treatments are the supportive treatments, like we are giving the antibiotics to the patient to prevent from the infection, because this patient is very prone for the infections. So we are giving supportive treatment for the patient to prevent the infections and other. Thank you.